Okay, this is Dr. Cohen. I'm here with Irene. Irene had an injury to her left wrist area. Could you describe what happened?
I was sharpening a knife and I just went a little too far back and came right back into my left wrist, and I punctured it to where I lost feeling in my hand. My fingers went numb and I was in excruciating pain.
Okay, so you did seek pretty rapid medical treatment.
Yes, I went to a doctor the next day.
Okay.
And he evaluated me, and he felt I needed to wait another week because the trauma was so new. And so then I went and saw him a week later, and he felt, because the pain was not subsiding, that I needed surgery.
Okay, and did he do any studies outside of maybe an x-ray?
No, I asked the doctor if he would have me perform an MRI, and he said no, there was no need. He had assumptions of what he thought could be the case of the pain. So that kind of brought a red flag up for me, because I felt not having an MRI, you want to have the most information you can before you have any kind of surgery, especially in your wrist with creating scar tissue in that area. Every time you cut, you create more scar tissue, and I didn't want that. So
Great.
I went and searched on the internet for a second opinion, and I happened to find, luckily, Dr. Cohen, and he actually advised that I should get an MRI, and we should evaluate my hand and have therapy. He also created a special splint for me to wear at night, and he gave me medication which was not harmful to me, and so it actually helped. And we did perform the MRI. The MRI results came back with no laceration to my nerve and no blood clot, and he said, I really don't need surgery. And here we are 3 weeks later, and my hand is totally functional and the pain has subsided. So
Yeah, it's a great lesson in getting a second opinion, and I even encourage my patients in certain scenarios to go get a second opinion. I also have a personal philosophy: if a patient asks me for a study, they're going to get one. If you want an MRI, I may tell you, I don't think this is going to help us, you may be wasting money.
Right.
But I will always honor that. Why not? It's just more information.
Exactly, before you perform any kind of surgery.
Yep.
And like Dr. Cohen said, it's always good to get a second opinion, and I am so glad I did, because who knows where I'd be right now if I would have listened to the other doctor and gone with the surgery. So
Excellent. Well, thank you so much. I think that's going to help a lot of people, and I'm glad that you are doing well.
yeah, thank you very much.
You're welcome.